morning, everyone. Happy Monday morning. We are so excited to have each of you joining us for this fabulous discussion regarding community health workers. My name is Tiffany Donaldson. I am the president and CEO of the Connecticut Health Foundation. We are an organization that is focused on health equity for people of color through systems change lens. So changing the policies that impact the lives of people of color. We believe that every person has the right to live their healthiest life, regardless of race, socioeconomic background, gender, education, any of the things that typically in our society may hold people back from living their healthiest lives. We believe people have access to that. The reason why community health workers are so important to us because we see them as individuals who are from the community of the community that can help be the linkage that many of us need in order for us to live our healthiest lives. Again, welcome to this fabulous webinar. I want to just go through something very technical as you are joining. If you would like interpretation, if you look at the bottom of your screen, you will see a world globe, and it is for interpretation. If you click on there, you can decide if you want Spanish interpretation, and we do have interpreters on right now joining us. I'm excited for this discussion today. We are going to hear from leaders around our state who are going to speak about the importance of community health workers. And then we will have a tremendous panel where we are going to continue to discuss the importance of community health workers and how we can move closer to sustainable funding for community health workers to assure that they are truly integrated into our healthcare system and into our health system overall. So we are going to get started with one of our wonderful speakers. We are joined with Dr. Deidre Gifford, who is the executive for the Office of Health Strategy here in Connecticut. Dr. Gifford, thank you for joining us.
Good morning, Tiffany. Thank you for that introduction. Good morning, everyone. Very nice to see you. I am Deidre Gifford, the Executive Director of the Office of Health Strategy for the state of Connecticut. I want to first say thank you to the Foundation and to Health Equity Solutions, not only for their work in this, setting up this webinar today, but also for your longstanding work in supporting the profession of community health workers and helping us at the state to better understand how our state policies can support and encourage the profession to evolve and get engaged with our healthcare system here in Connecticut. As you will see, I am joined by a number of my fellow commissioners this morning. And that, I think, tells you how much we are interested and value the work of community health workers in Connecticut. The Department of Children and Families, the Department of Public Health, the Office of Early Childhood, the Department of Social Services, the Office of Health Strategy, all of us are working together on this issue. And in fact, as we began to do some work around community health workers for our Universal Nurse Home Visiting Program, which we're going to be piloting very soon in Bridgeport, and which you'll hear about in a little bit, we began to realize all the places where community health worker work and policy was being done around the state. And we decided we really needed a multi-agency working group on community health workers so that we were collaborating and coordinating and making sure that the state was speaking with one voice when it comes to the profession of community health workers. So we have got that stood up. It's been a great education for all of us. I want to say a special welcome to those of you in the audience who are community health workers or organizations who employ community health workers. Thank you for your work, and thank you for what you are doing to ensure the sustainability and establishment of the profession in Connecticut. As a formerly practicing clinician, I haven't been a real doctor in quite a long time, but I know the value of having individuals from the community and the culture of the clients that I was serving and the gaps that are created when that resource isn't available. We know that community health workers help improve health outcomes. They target health disparities, and it's so important in the ways that community health workers can help us address the non-medical but social needs that are drivers of health and health outcomes. So I'm thrilled to be able to participate in this morning's webinar. I want to thank the organizers, and really anxious to learn and hear from all of you in the community doing this work. So with that, I will pass it back to you.
Thank you so much, Dr. Gifford. Thank you for your commitment to community health workers and for the commitment of so many of our state leaders in really supporting, sustaining, and moving the workforce forward. And with that, we do have another wonderful leader who, again, Dr. Gifford alluded to, who is fully committed to the community health worker workforce. We are also joined by Commissioner Manisha Jatani, who is our commissioner for the Department of Public Health. Thank you for joining us.
Thank you so much for having me here today. And it's a real honor to be with all of you to do this very important work. And I think what we can say is very clearly been demonstrated, especially in COVID, is how important community health workers have been to reaching our communities where they are, often living in the community, often speaking languages of people who live in the community. And I will echo your point that our commitment as a Department of Public Health to community health workers existed before COVID, but we relied on them significantly to be able to help get our state to be one of the most vaccinated states in the country. So, a few things just about community health workers. I want to echo Dr. Gifford's point of just recognizing all of you who are on this call and the great work that you do. But what we know is, as I said, they can be extremely effective public health and health care messengers in the communities where they live, and really help support the idea of advancements of health equity, specifically addressing issues of social determinants of health in the communities where they are. Now, DPH is actually responsible for the formal voluntary certification of community health workers, but it's a nice process that we have set in place to be able to give people that certification tool. And over the years, DPH federal grant funding has funded many different programs that support the community health worker workforce. So this includes, the identification as a professional identity by helping to support the Connecticut Community Health Worker Association and media campaigns of community health worker associations, sustainability objectives, working with our partner agencies like the Office of Health Strategy, and utilizing community health workers in the communities where they live. Like I said, with COVID, but even before COVID, we had examples of this that are far and wide, but one specific example I'll give is that of the Comprehensive Cancer Care Program. So the Connecticut Cancer Early Detection and Prevention Program has been utilizing full-time community health workers in every hospital system for the past 7 years. And these community health workers are integrated into the care team, actively participate in team meetings, and the training that they get really helps utilize them to be able to operationalize mobile medical equipment. So for example, breast cancer screening equipment, mammograms, motivational interviewing, goal setting with participants, helping people navigate the various different health outcomes and things that they need to do to keep themselves healthy, health coaching. So there's so many different types of things that community health workers can do. And this broad range of skill sets really gives a reflection on the essential role that community health workers play. Because at the end of the day, you may have services available, but if people aren't going to utilize them or know they exist or know how to access them or know how to connect or trust the person who's communicating the information to them, having these services is not going to make any difference. So it really is a great thing that we have available. And we as the Department of Public Health are very committed to this. I'd also just like to introduce Dr. Jody Terranova, who's a new Deputy Commissioner in the Department of Public Health, and she will also be helping to lead some of our initiatives on community health workers. She's listening in today as well. So with that, I will turn it back to you, Tiffany. Thank you so much for this opportunity.
Thank you so much, Commissioner, for your commitment to community health workers and also for demonstrating as a department and as a state how important community health workers are to our work. So thank you so much for your leadership within the Department of Public Health. We are also joined by another tremendous leader who is the Commissioner for the Department of Children and Families. And so we are joined by Commissioner Vanessa Durantes. Commissioner Durantes?
Thank you so much. And I'm equally as happy to be here as my sister state agency leaders and partners across health and human services, because if you haven't recognized by now from listening to my two colleagues, what you will hear in today's forum, and I really thank the organizers for putting this together to raise awareness to the things that we have in place across Connecticut that speak to this issue of care coordination and really working across systems to make sure that families have what they need. You will know that by the end of this forum. So we are very appreciative of the organizers for putting this together. Where DCF fits in this space is in a couple of different ways. While we don't hire community workers as defined through the Department of Public Health, what we do have are various categories of care coordination and community supports that we employ either with families who are involved in the child welfare or child protective service line of things, or externally to the department who are not involved, but we fund those intervention strategies. What you will also see in the coming months and year is this real renewed focus on prevention and how we define prevention, not just in the child welfare space of preventing children from coming into foster care, but how do you prevent those negative health outcomes? How do you prevent negative social outcomes? How do you prevent negative academic outcomes? How do you make sure that families thrive? Instead of looking at it from a deficit approach, what can we offer from a universal standpoint that all families can have access to, regardless of where they are in the state, regardless of what their zip code is, regardless of what their race or ethnicity is, that families have access to those things that will make sure that they and their children will thrive. So under the auspices of this particular conversation, community health workers or a similar type of definition for DCF looks like care coordination, in which last year over 1,500 families were served. We have intensive care coordinators that help families navigate our behavioral health continuum across the state. We have community support workers that we support through contracts with various state agencies, community workers that work in conjunction with some of the agencies who have contracts with us. We have peer specialists, which are people with lived expertise who have experienced the system themselves and are helping their peers or other families or other parents know how to navigate a somewhat complex system. And then we have intensive transition care managers who really work with very specific families with high-end needs that many of you may understand need additional supports from the state agencies. DCF heavily contracts for care coordination for both, as I indicated, community-based services as well as child welfare involved families. And to deliver the services, we rely heavily on our network of providers. We have providers that will also work through Beacon Health Options, which is our administrative service organization. They have a child and family division, which our integrated family care and support program works through. We have peer specialists under that particular auspice. And we also have community support for families, and another service that is very specific to child welfare involved families that also involves care coordination is reunification and therapeutic family time in the event that children have to come into care. So really understanding our interface with communities is a multi-pronged approach, not only across DCF, but across our sister state agencies, with our community partners and stakeholders who really help us connect with families in a way that promotes positive outcomes. So with that, you'll hear from you'll hear in real time some of those agencies today and what they do to really make sure that kids and families thrive. Thanks for allowing me to make a few remarks this morning.
And thank you so much for really recognizing the need for care coordination within our families, and also for your leadership in assuring that we are looking ahead and not behind, of assuring that kids and family have their opportunity to live their healthiest lives. So I really commend you and thank you, Commissioner, for your leadership in our state. So thank you. We have heard from some amazing state leaders so far. And again, you hear the care coordination piece and also the coordination amongst agencies to really promote the healthiest lives of our Connecticut residents. I also would like to now introduce Millie Seguinot, who is the Executive Director and founding member of the Community Health Worker Association of Connecticut. And Millie will just provide some remarks around community health workers overall in our state and give us a great introduction and landscape as we enter into our panel discussion. Millie?
Thank you so much, Tiffany. Good morning, everyone. I apologize for not being in camera. I have some last moment issues with the laptop, but I'm here and I'm so glad that we are taking this opportunity to connect. My name is Millie Seguinot, and I have been involved with the Community Health Workers Association of Connecticut since 2009. In 2012, the Community Health Workers Association of Connecticut, the formation began at the New England Regional CHW Summit in Massachusetts. From there, the association board of directors formed, and I was appointed president. The association planning proceeded with leadership from the board of directors, community health workers champions, and community supporters. In 2014, we worked with a work group within the definition for community health worker. And it's important to know that we did few things related with this, but I want to mention as well that in 2012, the association became a section of the Connecticut Public Health Association, or CPHA, and that is the status that we carry at the moment. Coming back to 2012, we worked with this working group and we created a definition for us in Connecticut. But then in 2012, we got involved with the State Innovation Model Program, and we had to tweak that definition a little because we needed at the moment to make it more in a way that worked for us based on the needs for Connecticut, and we did that and it was approved. Then, because of the everything that we were working to bring a certification to community health workers in Connecticut, we had another, and this is the final definition that was approved by legislature in Connecticut. It was approved in January 1st of 2020. And that says that in Connecticut, by law, community health workers are public health outreach professionals with an in-depth understanding of the community's experience, language, culture, and socioeconomic needs. Among other things, we serve as liaisons between community members and healthcare and social service providers. And we provide a range of services, including outreach, advocacy, and care coordination. This is all related with the Public Act 19-117. So anyone that is interested in learning more about this, you can go to this information and read more about it. So when we talk about community health workers, we think about why are we so important? Well, community health workers are important because we are the workforce linking individuals from the community with the correct resources that the community needs. We represent the community that we work with, and we understand their challenges and different life experiences. We guide the individual in a way that we help them become empowered, self-sufficient, and ready to advocate for themselves so they can live a better quality of life, because that is our goal. We are the voices of those that don't know how to work with the system, or they don't speak the language. We are important because we meet people where they are, because we are culturally humble, because we are empathetic, not biased, and we don't discriminate. Community health workers are part of the clinical team, even though we are not clinical, and we don't necessarily need to be at a healthcare setting. We are public health professionals working with underserved communities. And as I mentioned before, we can work in different settings like schools, nonprofit organizations, housing, transportation, and many other settings that we know we are being hired to work with different people in the community. We go by different names, and that was mentioned, as the community health worker is the umbrella team. We are important because we have come to make a difference in our community. Thank you.
And thank you, Millie, so much for providing a great overview of community health workers here in our state and how we got to where we are today. And also for continually to raise and highlight throughout our state the importance of community health workers and who they are and why they are so important to our community. So thank you, Millie, for all the work that you are doing in our state, and also for all the things that you do to highlight and uplift community health workers. I am so pleased that we are now going to transition to our panelist. And with that, I would like to introduce Liany Arroyo, who is the director of Hartford's Department of Health and Human Services. She oversees 5 divisions aimed at improving and protecting the health of Hartford's residents and visitors. Liany will be facilitating our panel. Thank you so much, Liany, for joining us.
Thank you, Tiffany, and thank you so far to the commissioners and to Millie and to those of you who have spoken. It is my great pleasure to be here today to get into the meat of this webinar and start speaking to people who are on the ground doing the work. And so I've spent about 20 years doing this work myself in various ways nationally and here now locally with COVID in Hartford. And I see that some of our CHWs, promotoras, are on this webinar, so I'm glad that they're here. But we're going to jump right in. We have a great panel, 2 individuals who employ community health workers and 2 individuals that are community health workers to talk a little bit about what's happening in Connecticut and what they're seeing. And so I'm going to jump right into introductions. First, we have Kelley. Kelley is a director of grants and impact with Project Access in New Haven, which employs CHWs and also partner here with us in the city of Hartford. So thank you, Lauren. We also have Scott Umbel of the United Way of Southeastern Connecticut, and he is a vice president of community impact. The United Way of Southeastern Connecticut convenes outreach organizations that employ community health workers under grants that they manage. Next, we have Bianca Noroñas of the Hispanic Health Council. Bianca is a program manager at the Hispanic Health Council Nutrition Center and is also a CHW here in the state. And last but not least, we have Fatawu Mahama. He's with Southwestern AHEC, and he's a community health worker with the Southwest AHEC here in Connecticut. So I'm just going to jump right in with the first question. Then I'm going to ask all of our panelists to please try and be concise. You have a few questions. We want to make sure that we leave room and space for our attendees to ask questions as well. So the first question is for all of you, and I'm going to go in the order of my screen, so we're not talking over each other. But you heard all of the opening comments, all of the great and wonderful things that the community health workers in our state are doing. So why don't we see them everywhere? What's standing in the way of us, in the way of Connecticut having more CHW services available? So I'm going to start with Bianca.
Hi, good morning. In my opinion, the problem of inconsistent funding prevents the community to enjoy the benefits of having more community health workers in our communities. benefits, as we already hear, benefits to the physical health, mental health, and others, access to resources in the community, educational material. So that economic barriers is in funding affects of the community having more community health workers, and as a result affect the community outcomes health.
Thank you, Bianca. I'm going to go next to Fatawu.
Thank you. So with not seeing community health workers all around, I'll start by saying, I know Millie mentioned that earlier, and then some other presenters, it's about the title of community health workers. So we do have a whole lot of community health workers working in different settings. They do have, or they do carry different titles, but knowing very well that the term community health worker is the larger umbrella for community health workers. And we have titles under that, over 100 titles that falls under the community health worker umbrella. And then just going by what Bianca said, also funding also is an issue for community health workers. We do have issues where community health workers are employed for just a very short period of time, just because the grant has ended and their services need to be cut short. This leaves the space of community health workers empty, and that kind of remove them from the spotlight of the community. So therefore, they are not seen, or they are not notified, or they are not known to be existing within the community. So just those 2 points, I will stop there. Thank you.
Thank you. Lauren.
Yeah, hi everyone. Thank you so much for including Project Access. I will say the first thing that comes to mind for me as well is funding. Project Access is a relatively small organization, and we rely heavily on grants to support our programs. So for us to grow or even to sustain our CHW services, we're often, relying on our grant funding and looking at funding sources. And I will say, while we certainly appreciate all of the great grant support that we've received, it is a lot of work to keep up with a constant cycle of applying for grants and reporting, especially when you're a smaller organization. And then another big factor, as was already mentioned, is the longevity of the grant funded programs and some of the challenges around sustaining the staff and services once those grants have ended. We're actually in a unique position right now where we've been doing collaborating on 2 large federal grants that support most of our community health worker services, and both are ending this year. So, we've been working probably for over 1.5 years trying to apply for funding and looking at our staffing and trying to shuffle things around to make sure that we can try to keep our staff and sustain those services. So just ongoing discussions about how to piece together funding from different sources, often, different grants with different requirements and different funding cycles to keep that in place. And the last thing I'll note is that, Project Access is also working closely with Clifford Beers on the INC initiative. And that is a CMS program that will pilot a payment model with reimbursement for intensive care coordination for Medicaid beneficiaries. So we're really excited to be one of the first organizations that's going to provide services through INC this year. And that does, give us another potential way to fund our services in the future. So while I'm sure that also has challenges around reimbursement, that is one thing that we're looking forward to looking at.
Thank you for that, Lauren. Scott.
Thank you for having us, again, representing United Way of Southeastern Connecticut in what I would consider as a unique partnership in our state. In collaboration with the Office of Health Strategy, our team leads a AHEC health and enhancement community here in our region. It's a 13-town initiative supporting 32 partners. And like some of our partners here, we rely on a lot of grants. We leverage multiple grants in our region to bring in funding. And so, why don't we see CHWs everywhere? For this past year, I think we've seen more CHWs than we ever have. But like Lauren shared, that's for the right now. That's not permanent, and it's going to go away very soon in the next 13 months. Those CHWs are deploying in really unique ways. We are experimenting and trying to break that mold of everyone's nails on the chalkboard of this is the way we've always done it, because the system's not working. So we need to experiment. Our CHWs, through 5 different partner agencies that employ them, are deployed in a region through mobile health hubs. This past few months, they've been hitting 2,000 households across 10 mobile health hubs every single month. which is incredible. We're working throughout the group and all these CHWs and bringing them together to be more efficient and collaborative, so that way we're not all reaching out to the same church to get the same ambassador to do the same message, but can they do that strategically and do it together? So there's been a lot of collaboration and excitement, but again, that collaboration and excitement is going only to continue through these short-term ARPA and CARES Act grant funds. And come a year from now, all of those staff, literally the full-time staff leading that role, will go poof. That capacity can connect with our communities will go by. All those individuals connected to mobile health hubs won't have those resources, won't have those individuals coming in to inform them about home heating assistance and mobile health screenings and getting their A1C levels measured and vaccinations and beyond. And that's only happening because of these grant funds. And just to continue to beat the dead horse, sustainability is the biggest piece that is in the way of these individuals staying in our community.
Great, thank you, Scott. And so you touched a little bit upon this when you were speaking about the roles that they have. So we're going to jump right into that question. And again, just a reminder to try and be concise. We got a little bit less time than we had hoped. So Scott, I'm just going to pick up on that. You mentioned a little bit about some of the roles that the CHWs in your organization are taking. Can you expound a little bit about that? What other things are they doing?
Yeah, and to mirror my colleague Fatawu, CHWs fill literally 100 different roles and titles, and you don't go online and just hire a CHW. They're doing a little of everything. They're individuals that are mobile health hubs that are handing out flyers to inform individuals while they're already coming in to get a health screening or at a vaccine clinic about other opportunities they might need around dental cleaning, dental hygiene, and mental health assistance, and all those other social determinants of health that support a household. They're there to make those connections at the mobile health hubs, at their churches, in their community, at their schools. And there's so many different ways that a CHW gets deployed that I wouldn't say there's one rubber stamp way that all of us are doing that work.
Great, thank you. How about you, Lauren?
Yeah, so Project Access is a nonprofit, and our mission is to increase access to medical care for Greater New Haven residents who are underserved. So the way our organization has evolved over the years, we have two teams. One is a team of patient navigators who focus on connecting our clients with timely medical care, and then we have a team of community health workers who focus on connecting patients with resources for health-related social needs. But that being said, we know that there are a lot of titles for individuals who provide these types of services, and certainly there's a lot of crossover and overlap. So in fact, many of our navigators are certified CHWs, and those services really are it's just sort of the way that our teams, the terms that we've used. And just for some background, our initial program that we still offer was designed to serve patients with urgent healthcare needs, so that coordination of medical appointments and facilitating follow-through with clinical care was really the focus. But very early on, we began hearing so much from our patients about these other social needs that were impacting not only their ability to access care, prioritize their medical care, but really to even fully benefit from the care that we were connecting them with. And so that need really is what drove the addition of the CHW team over the years. But we have had our CHWs do all kinds of different work. We actually had a grant where we had a CHW who was helping patients in the primary care center to access their health information with a mobile health app. Our CHWs do outreach in the community. We have a COVID trusted messenger initiative. So there are really so many different ways that they can support our community and our patients.
Great, thank you, Lauren. So Fatawu and Bianca, we've heard from Lauren and Scott the sort of myriad of ways that you and your colleagues are deployed in the state, but that's the actual job. There's sort of that, I always call it the secret sauce of the people that do this work, of the women and men and youth that do this work. And so I'd love to hear from you, what is the unique value that you bring to this work, right? What's the value that you bring to handing out those flyers, to going, helping someone, talking to them at a community center or laundromat? So I'm going to start with you, Fatawu.
Thank you. So with community health workers, we do come with a lot of experience and also lived experiences as well. And I will start with the common 11 skills of community health workers. So with community health workers, communication is part of some of the benefits will bring to the teams that we work with. We are able to communicate with the community at a level that the community is able to understand. That also includes interpretation, culturally and linguistically appropriate approach to the community in order for them to be able to understand the resources we provide to them. I know our commissioner mentioned about if we have resources and we are not able to deploy them in the community, is equally as the same as not having those resources. And it's true. If we have those resources and we don't have the people to communicate those resources to the communities, it becomes like we really don't have those resources. So we do take a very big part of that in delivering those resources to our communities. Service coordination is also part of the work we do a lot. We are able to coordinate a lot of services within the community to provide a lot of less burden of social determinants of health to our communities. We are able to also, because of our lived experiences, we have a whole pack of resources within our belts that we can also share with our clients, just because we have also went through those processes that they are going through. Capacity building, Millie touched on this a little bit. We are not looking to always be with the client all the time. We want to build the client's capacity in order for the client to be able to take charge of their life, take charge of their resources, take charge of their health, in moving in the right direction for themselves and their families and their communities. We also advocate for our clients, which is the biggest part of the work we do. We always stand to advocate for our clients. We always stand to advocate for our communities, no matter what it is. If it is something that is beneficial and productive and improve the health of our communities. We also provide education to our community, either health education, resource education, just for our community to understand what is available to them. Individual and community assessment, we help in that because we are trusted members of the community. Our communities trust us. They trust us. They trust us to be able to offer them what they need and what is really something that will help them out. We provide outreach, professional skills and conduct. We also provide evaluation, help and research. Knowledge base is also one of the most important things I would like to talk about, because we are people who understand what is going on in the community, because we live in those communities. We also have the lived experiences, and that helps us to be able to provide a lot of good resources to our communities. And I'll stop there. And if you have any questions, I'll be happy to answer. Thank you.
Thank you, Fatawu. How about you, Bianca? What is the unique value that you add?
Yes, in my perspective, one of the most unique values a community health workers bring to the community or the family or individual that we are serving is trust and confidence. For example, community health workers are like the frontline workers for our communities. We normally are from the same community we serve. Not everyone, but community health workers, there is community health workers like me that learn here in United States English, so we have the second language. Some community health workers like me born outside of United States. I only have 5 years here in United States. We usually have similar background experience, and of course, we face the same barriers too. So that helps, and to work with the that helps with the trust. And when we are talking with the familiars or individuals, to know them better and to share with them the research or educational topic, they feel better because we feel familiar to them. We are aware and we protect the cultural responsive environment, and they feel more safe with us. So that's why they are more open with us. They share with us their reality, and also are more open to learn with us their rights. So they believe in our words, and sometimes they cannot feel the same with other type of professional outside of the community. Because normally they speak other language, they doesn't live in our community, and the vibe is completely different. So that's why, in my opinion, one of the most important values community health workers bring is trust.
Thank you, thank you, thank you. So we're on our last question, and we're running short on time. So I'm going to ask you all to just give me a couple words on this last question. We'll go round robin again. And we're going to start with Lauren. I'm mixing it all up here. So for everyone, what do you believe community health workers in Connecticut need to be successful? So Lauren.
So I would say that one critical factor is resource availability. The CHWs are wonderful connectors, and they really take the time to understand clients' needs and connect them with resources. But when resources aren't available, I think that becomes, a challenge. And so we see this most often, I think, in the housing realm. Our CHWs sometimes struggle with housing. They want so much to help clients who have housing needs, but sometimes the resources aren't always there. And that, I think, is especially tough for someone who really wants to help. They want to try to keep the clients engaged, but also want to be honest and realistic about what they can do around housing needs. And then the other thing I'll just say is around evaluation, because that is an interest of mine, and I know we're seeing a lot more of that. Saw a recent report from the Connecticut Health Foundation, but just investing in the evaluation to demonstrate impact and the benefits of CHWs, I think, helps with the long-term sustainability and quality improvement.
Great, thank you, Scott.
To mirror my colleague Bianca, I think our CHWs that are most successful are from the community and represent their community. And I think that's a critical piece of that trusted messenger and that connection. And just to continue it without that resource, and agreeing with Lauren, consistently there and reliable, and the funding that supports that, I think, is another critical element to that success long-term.
Great, thank you. Bianca?
Yes, I think we need the active support of the people that have the power to make the legal change to the structure that every day prevents community health workers to have access to more community health workers. And when I mean active support is to be more vocal and talking to their peers who are also leaders and have the powers to break down these barriers. So more people are advocating more for the sustainability of community health workers' fundings.
Great, and Fatawu.
Yes, also I'll talk about a little bit about what my colleagues have talked about already, sustainability. I think we need a more sustainable environment for community health workers, funding, integrating community health workers into health systems and also into community health services. One other part I would like to touch is training for community health workers. We need robust training. Apart from training community health workers, we also want our organizations that we work in understand who we are, because most organizations don't understand who community health workers are. Even though they have them, they still don't understand what they do and who they are. So I just want to talk about that. So the specialization of community health workers, training, we need to also expand on that, which is like having the core competency training and also the specialized training for community health workers that targets or that directs the community health worker to a specific role that the organization wants the community health worker to fill. Thank
you. Great, thank you, Fatawu, with that. And thank you all to all of our panelists. I heard lots of great nuggets here. So it's a really brief recap. We know that community health workers go by many names: promotores de salud, care navigators, care coordinators. There's a whole robust naming system depending what part of the country and what kind of work they're doing. They also have many roles in what they're doing in our community. It can be as, just talking to people, handing out a flyer, making sure people know about resources, or it could be holding their hand to get them to a place where they can feel free that they can go on their own and access resources. We heard that trust, confidence, safety, language, lived experiences are all unique assets that community health workers bring to the role. And I, will say that's something that's been a big part of our work here and has made them successful. And then lastly, we heard what is needed in terms of making sure that they're all over the state. We have resources, funding, integration, specialized training, and I will make mention as a moderator's prerogative for right now, when we think about this work and we think about why we may not see them, or we're thinking about funding, I'm urging everyone, especially since we have so many commissioners on this call, when you're thinking about your work and putting out RFPs, think about making this a required piece of the work. Many of our state agencies get funding that gets renewed, and this having that sort of stable funding source is really critical, because this is a lower paid workforce that comes in at an entry level, and creating those steps for them to move forward is critically important. And it's also good to remember that they create the diversity that we don't have at the upper levels. And so by supporting them at these levels, putting the funding behind it, we do and can create a more diverse workforce in the state of Connecticut. And with that, I'll end. Thank you, Tiffany, and everyone else.
Well, thank you all so much. This was an amazing panel, and I appreciate how quickly you moved, but how much deep information and important and critical information that we received in this panel. So thank you all who participated. So thank you, Liany, for your wonderful facilitation, Bianca, Lauren, Scott, and Fatawu. We are now going to be joined and hear a few remarks from the Office of Early Childhood. We are joined by Deborah Burrell, who is going to give us some insight into the work that the Office of Early Childhood is doing and how they're integrating community health workers. Thank you, Deborah.
Thank you, everyone, and good morning. On behalf of Commissioner Bai, let me first thank Tiffany Donaldson and the Connecticut Health Foundation for covering and convening this informational session on community health workers. And a special thank you to the 5 commissioners who have served as role models in the creation of an innovative program, the Universal Nurse Home Visitation Community Health Worker pilot program of Greater Hartford that's intended to utilize nurses and CHWs in the creation of a system of care to support the physical, behavioral health of mothers, newborns, and families through the prenatal and postnatal period. The intention of the program is to address issues of health equity and social determinants of health. And under the program, the RNs will perform 1 to 3 home visits, then create a care plan to hand off to the CHWs to ensure that identified family needs are addressed and hopefully resolved with the assistance of the qualified community health workers that we will be working with. We're honored to be working with Bridgeport Hospital and Southwestern AHEC on this innovative program and model of care, and look forward to working with the CHWs who are essential in ensuring that the mothers and newborns issues, their mental, physical, behavioral health is addressed in a way that impacts their morbidity and mortality rates, hopefully improves morbidity and mortality rates that we've seen escalate over years. So that's our intention. We look forward to working with you, and thank you for inviting us to this wonderful session.
Thank you so much. And thank you to the Office of Early Childhood, which is also led by Commissioner Beth Bai, who is a tremendous leader, also thinking about how agencies can work together, and the work of the Office of Early Childhood specifically in really promoting the health and well-being of our children here in Connecticut. So again, I really appreciate that we have heard from many of our tremendous leaders across our state. And so we are so excited. And I do believe that Commissioner Bai is on this call as well. And so we may have her come in and interject for just a second while we work, and she is on right now. So Commissioner Bai, if you would like to also provide some great words as well, that would be absolutely phenomenal. So I see that you're on, and you can come off mute in camera if you would like. I don't know if we're dealing with any technical issues. As we all know, even though we're 3 years into Zoom, it sometimes is a challenge. Well, what we will do in interest of time, because I do want to hear from Commissioner Bai as well, but we also are joined by Carl Rush, who is going to provide an overview of what's happening nationally. And Carl Rush is the founding member of the National Association of Community Health Workers Board of Directors, and he is a nationally recognized expert in CHWs. So we'll have Carl provide 2 to 3 minutes of brief comments, and then we will return so that we can hear from Commissioner Bai before we close out. Thank you.
Good morning. Thank you, Tiffany, and thanks to the foundation and to Health Equity Solutions for this invitation. I will be sharing the slides, so it looks like I won't be able to get through them all. I was asked to do about 20 minutes, so I'll get as far as I can. I'm not going to say everything I would like to say or would normally say about each of these slides. Because we have so much to get through, but also in consideration for our hardworking interpreters who we appreciate here in Texas how important their work can be. I will be referring to the National Association of Community Health Workers as NACHWA, and I will be doing that in the interest of time, but also community health workers as CHWs. So I was asked to talk about sustainability, and I will also be touching on scaling, which a lot of us have not yet really begun to deal with. But very quickly, the notion of sustainability is about more than financing. It is about the adaptation that an organization needs to make to maintain community health workers as a permanent part of their organization. So it's going to take a certain amount of infrastructure. The organization has to be ready. They may have been employing community health workers, CHWs, under grants. It's a very different thing to integrate them as permanent parts of the organization. This is more of a change than a lot of people expect. Supervision is crucial to getting the full benefit of having community health workers, CHWs, in your organization. Someone has to invest a significant amount of money in workforce development. And of course, you need to evaluate the programs in which they operate. So I mentioned scaling. This is because, and a number of the speakers ahead of me have talked about the importance of expanding the employment of CHWs, but how many does Connecticut really need? How many does your community really need? We don't really have a good handle on that. We, in most cases, and I think in almost all of the states, we don't really know how many we have now. And that's because community health workers are not regulated in the sense that licensed professions are regulated. So we don't automatically have control of that. People can do the work of CHWs in Connecticut and in every other state without being certified. And so, and that is an important element of certification. And so it's hard to count them. It is hard to enumerate them. Unfortunately, the numbers we're getting from the federal government are probably not reliable. So sustainable financing, of course, is a problem. Public health does not have the kind of ongoing streams of revenue that would be important for this work. And there is nothing like Medicaid designed to meet social needs of the populations in vulnerable or disenfranchised communities. And part of the solution of that is that many employers are now already employing CHWs as part of their general budget without a dedicated funding stream, because it makes programmatic and financial sense to their organization. That is happening increasingly across the country. We are fortunate that people have learned a lot from the experience of COVID, and they have learned the value of CHWs in meeting the needs of the communities that have been hardest hit. Low-income communities, people of color, disenfranchised peoples. And the response of the federal government has been very dramatic in terms of funding that can be used to build infrastructure. So there are grants that states are receiving that are being used to help build the training infrastructure and so forth, and the policy infrastructure for community health workers. I'll talk in a minute about Medicaid and what that can do, but there is a lot more action in that area right now. We're learning a lot. And the Office of Minority Health in the federal government has as a top strategic priority improving sustainability of community health workers. So they have taken on a leadership role in that, and we're very excited about it. I would say that in a lot of the things that I just told you about, our executive director at NACHWA, Denise Octavia Smith, who is on the call today. Hi, Denise. She has been at the forefront of a lot of the activity nationally around COVID and the infrastructure building process. The sustainable funding has been a topic for a long time, and these are some of the studies that have contributed to our knowledge. I've been working on this specific issue for more than 20 years. It has been a lot of work, but fortunately, we're really making progress now. We talk, of course, a lot about Medicaid because that is crucial. If we're talking about sustainable funding, Medicaid is the elephant in the room. And there has been a huge growth in interest in Medicaid, again, largely because of COVID. There are a bunch of states who are already financing CHWs under Medicaid through waivers and state plan amendments. And we are learning from the experience of peer support specialists who are already paid under Medicaid in many more states. So we're actually in conversation with them, their national leadership at this time. But we have to remember that Medicaid is not the only thing we need. Medicaid will never do it all. So we do have to be looking at other sources as well. But I was asked to talk some about Medicaid and where we can go. And there are some barriers to paying for CHWs under Medicaid. Medicaid was created as a medical assistance program to pay for health care to low-income individuals. And the community health worker activities are generally not included in the basic benefits that the federal government requires states to cover under Medicaid. Community health workers are also not defined as providers. This is in the Social Security Act, which is the basic federal statute that created Medicaid. They are not listed as providers there. And of course, we all are aware that Medicaid can only pay for services to people who are eligible for Medicaid. So that leaves a lot of people out in any state. So nonetheless, we've heard a lot from speakers already this morning about why the state and why Medicaid specifically is now getting much more interested in CHWs. Those things are all important. Your ability to communicate with the Medicaid population to address health equity, social determinants of health, to help to control costs and to improve the quality of care. But also in the bigger picture sense, healthcare generally is changing from a transactional system to a relationship-based system. And by transactional, I mean most of us experience a need for healthcare. We go to a provider, we get that care, and they get paid. It's a transaction, but we walk away, right? So it's like using a vending machine, okay? You get what you need and you pay for it and you walk away. It's a transaction. Relationship-based care or patient-centered care or person-centered care or whole person care involves a much bigger picture of everything around that person than just a transaction in healthcare. And the good news about that is that CHWs are in a unique position to develop the trust and the communication. We've heard our panel talk about that. You're in a unique position to create the trust and communication that is necessary for relationship. Okay, so I mentioned Medicaid and the recent activity. There are now 10 states that have state plan amendments related to CHWs in Medicaid. Most of the recent proposals for CHW funding have taken a broad view. Again, we heard our panel talk about the range of things that community health workers do. The first Medicaid payment for CHWs was only for health education. That is changing. It's starting to be broader, and Medicaid is appreciating the value of that. I'll skip that for now. There is a provision in the Medicaid regulations that a bunch of states have taken advantage of, which really opens opportunities for the states. So most of the state plan amendments for CHWs, the recent ones, have relied on this rule or this authority under Medicaid. And that rule was effective in 2014. And it simply said it was changing the existing rules to say that preventive services must be recommended by a licensed clinician. Previously, the regulation said they had to be provided by a licensed clinician. And this opened up a lot of possibilities. Nothing much happened. You see, 2014, nothing much happened with that for 6 or 7 years. And now all of a sudden states are taking advantage of it. And partly because prevention can include primary, secondary, or tertiary prevention. Tertiary prevention is preventing the progression of a disease or health condition, which means prevention can cover just about anything in healthcare. This is great news. And the other point is that under this rule, the CHW does not have to be directly supervised by a licensed clinician. Okay, so as I said, states are interested in a broader range of services. They generally cover these 4 categories, and I will let you read them when you get the slides. You will get a copy of the slides, but it shows you, if you look at this list, this is a broad range of things that CHWs are very capable of doing, which can make a huge difference in the quality of care and reducing the growth in healthcare cost. Okay, so any state that's going to be looking at this is going to need to follow certain steps. I'll go through these very quickly. One is increasing the capacity of CHWs and community-based organizations to participate in the policy process. I'll come back to that. You need to have a clear definition. In Connecticut, you do have that. You're way ahead on that, and you have already defined scope of practice and skill requirements. You've defined standards for educational programs. You have decided to have certification. Other states are still deciding that. And then you need a strategy. And I'm sure that that's what a lot of you are thinking about right now. What is our strategy going to be for sustainability? And then finally, pursuing funding commitments. And this may take the form of legislation. I hope there are legislators out there who are hearing this, but many of the strategies that states pursue on sustainability require legislation, but they do require commitments, which includes budgeting and appropriation, of course. Now, the last point I want to make on this, and then I'll close out with a few other related points. The state's choices in how to pay for CHWs can make a big difference in the work of CHWs. And that is why it is essential that CHWs be at the table when you're talking about these choices. What services will be covered? We talked about the range that can be covered. Most states have a limit on the amount of time that a CHW can bill for with each individual client. Rhode Island is the only one that does not have a limit like that. You need to set the hourly rate of pay or hourly billing rate, excuse me, the hourly rate of pay for the CHW and other related costs, partly because CHWs, by the nature of their work, they need to spend a lot of non-billable time on developing and maintaining relationships. That is crucial. An important decision, you might not think it is, but some states have had a hard time with deciding what settings Medicaid will pay for services. And we advocate, all of us really advocate, that they should be billable for services, any of these settings. And then who may refer a patient for services from CHWs? Who may order them in the sense of ordering medical care services, and who must supervise? Those are really important decisions. And lastly, and I can't emphasize this enough, a large proportion of CHWs are not employed in healthcare at all. They're employed in community-based organizations. And if Medicaid is going to pay for these services, how can community-based organizations be part of that system? So a state like Rhode Island is spending a lot of effort figuring out how to partner with CBOs. Almost done here. We have on the NACHWA website a report. We're updating it now about sustainable financing. We just published with the National Academy for State Health Policy an issue brief about what we've learned from the 10 states that have state plan amendments. And I want to offer to you in Connecticut what we've done in a bunch of states so far. This is a 2-hour webinar on the basics of the internal workings of the Medicaid program. We want CHW leaders to be at the table for these decisions. So you need to know more about how the Medicaid program works internally, how they make decisions, how they pay for services. This webinar is available courtesy of NACHWA to any state if it is offered to CHWs only. And it was created with the help of your neighbors in Rhode Island. The primary audience is community health workers, but we have offered it in some states to allies. There is a cost involved in that if you want to offer it to non-CHWs. And we customize it for the state. So we refer to conditions in each of the states where we do it. Lastly, I wanted to plug our Document Resource Center. It is available through the NACHWA website under the Policies tab on the homepage. This has over 1,000 documents on the process of creating policy around CHWs and what the results have been in a bunch of other states. So these are the major topics. You can read them for yourself in the database. And there's a wide range of types of documents in there, not just articles or studies, but flyers, meeting agendas, fact sheets, things like that. So I urge you to use that, to learn from it as you contribute to policy in Connecticut. So I will wrap up there. I ran over a couple of minutes, but thank you very much for this opportunity, and I look forward to further conversation with you all. So I'm going to stop sharing, and I will figure out how to do that in just a second. Okay,
well,
there we
Carl,
go. Okay.
thank you so much. I mean, that information was rich and needed and necessary. And if you can put the website link to NACHWA, that would be phenomenal, because many of us would love to follow up. Thank you so much. And again, there's so much that can be done related to how we consider our policies to really support the sustainable funding of community health workers. And I appreciate, Carl, that you put in one of the most critical pieces, is that assuring that community health workers are at the table as decisions are being made and as we are thinking about this work moving forward. So Carl, thank you so very much for your insight and for all of the work that you are doing nationally around this issue. I just want to pause just for a second because we do have Commissioner Bai who is on, and I do want to give her a moment to provide some words, and she is our fabulous leader of the Office of Early Childhood.
Hi, Tiffany.
Hello.
Thanks so much for having me, and I will be brief. Some things happen for a reason. I got on early to listen, and I was able to hear my fellow commissioners and the panel and Carl. And for me, it was really important because my background as an early child provider doesn't always bring me in the health space, and to hear about the incredible value that community health workers offer to our system. So Debbie Porio really covered the Universal Home Visiting Program and what's happening at OEC in partnership with the 5 state agencies. I thought I would just start by saying, I would just quickly say a big thank you to Commissioner Gifford for her vision for universal home visiting when we first were thinking about what was needed, and then also the idea and Laura Morris's advocacy that community health workers were a really important part of this. If you're going to have nurse home visitors, you also need to make sure you have connections in the community to add those community health workers and what an important role they could play. And then just to highlight a few things that I heard, I think that Commissioner Durante's points about prevention and helping families thrive was something I heard through the panel as well. And the panel really stressed the importance of collaboration and coordination, and that's going to be a heavy lift in our home visiting, both the launch and then hopefully expansion of home visiting. Each region is different, and community health workers can really help with that. And then just the point again and again by Fatawu and Scott talking about stressing how important sustainability is. If you're going to work with trusted community members to help you deliver a program to help their community, you can't pull the rug out from under them after they spend a lot of time building a system. So Tiffany, I think your work here coordinating this panel and this morning is so important. We really appreciate your leadership and the leadership of the Connecticut Health Foundation. I think you see this as something that's so important for the future of healthcare and for health equity, and we do too. So I'm really grateful to my fellow commissioners. Commissioner Jutania, I got to hear some of her talk too, and you can just feel her sort of commitment to overall public health. And we all have a deep understanding that community health workers are part of the future of high quality healthcare and health equity and prevention. So thank you for letting me say a few words, and I'm going to hang on and listen a little more.
Thank you so much, Commissioner Bai. And again, thank you for all of your leadership. And I am going to close out my portion and turn it over to Aisha Clark, who is the Interim Director for Health Equity Solutions. But I do want to say that, as noted, community health workers are so critical to assuring that communities have the ability, and families and individuals have the ability to live their healthiest lives as they define it. And community health workers are such a critical resource to assuring that for communities who have been left behind. And so as a foundation, we are really committed to assuring that community health workers are integrated into our entire health system. And we can do it together. We heard that there are solutions for how we can move this work forward, how we can get to sustainable funding for community health workers. And it is going to take every single person, every 200 people who are part of this call to do it together. It is critically important that we work together, we do together. And so again, I thank our state leadership. Dr. Gifford, thank you for coordinating across agencies and all of our commissioners. We really, really appreciate your commitment and your partnership in moving this work forward. We're going to move on. Again, I'm going to turn it over to Aisha Clark, who is going to facilitate Q&A for us and also going to close us out. So Aisha, and thank you, Health Equity Solutions, so much for your hard work and partnership around all of this work.
Thank you so much, Tiffany. As stated, my name is Aisha Clark, and I'm the Interim Executive Director at Health Equity Solutions. For many of you who do not know, Health Equity Solution is an organization that stands and understands what it means and the importance of community health workers. At the end of 2021, in partnership with the Community Health Worker Association of Connecticut, HES held events asking community health workers for their priorities for their profession. They told us the need for sustainable reimbursement, and it was clear theme throughout the different sessions. In response, throughout 2022, HES has worked with the Community Health Worker Association to convene a group of community health workers each month to draft their version for Medicaid community health worker reimbursement in Connecticut. This group of community health workers and their allies came up with a set of principles. The first one is that person-centered. This is that community health workers are receiving the resources and financial support they need to provide the variety of services they already provide. Number two is financially being sustainable. Community health worker wages are high enough to cover living expenses and attract good workers. They really felt that it was important that individuals understood they needed a change and a shift in the amount of money that they're being paid. And then lastly, accessible. This is that community health workers are able to work in any environment and provide the services necessary to meet the needs of their clients. We expect that this will be raised during the current legislative session. And if you'd like to receive updates or action alerts, please sign up for HES's newsletter to reach out. And as Tiffany shared, before we close out today, we wanted to thank you all and have the opportunity to ask our speakers questions. We had a packed agenda, and so we know that there was a lot of information that was observed and taken in, but we hope that we'll share your questions in the Q&A box and or in the chat. Some of you have already done that, and so I'll go ahead and start answering that, asking that question. And if our speakers, if this question is relevant to you, if you can please go ahead and take yourself off of mute to answer that question. One of the first questions that we received was, what changes would you expect to see if Connecticut invested more in CHWs, especially for Medicaid enrollees in the systems and or providers that serve them?
Well, I think any of our panelists can speak to this, and I'm sure Carl has data, but what we know overall is that when community health workers are integrated into the care of an individual and or families, health outcomes are better. So we're looking at closing some of the disparity gaps within the state. One of the key tools we have are community health workers because they do help the overall outcomes for people, in particular people of color.
Dr. Gifford?
Aisha, I did want to mention something that I neglected to say in my opening remarks, and that's relevant to the question, which is that we are embarking on incorporating doulas into our Medicaid payment policies for childbirth in Connecticut. And we've been working with the community and providers on this. So in answer to your question, one of the ways we anticipate a difference is that we're hoping to broaden the team that provides care in and around childbirth, in not only postpartum, what you heard about from Debbie and Commissioner Bai with the Community Health Worker Program, but also during the prenatal and intrapartum period where the support of doulas we think will really be important in tackling issues of disparities in outcome and social needs related to pregnancy and early childhood. So that's a concrete example of how we're incorporating one of the many flavors of community health worker into our Medicaid program in Connecticut.
Thank you so much, Dr. Gifford. Lauren?
Yeah, hi. I was just going to speak a little bit about some of the evaluation work that we've done at Project Access over the years. One of the things we're really proud of is that our patients tend to have a really high rate of compliance with their clinical care. So we see a really no-show rate. Our patients are showing up for their healthcare appointments and getting the care that they need in a timely fashion. We even did a randomized control trial a couple of years ago where we were looking at frequent emergency department users who are Medicaid beneficiaries and helping them gain access to primary care and engage with primary care. And we saw a decrease in ED visits. And then, through surveys, we look at things like health-related quality of life. So we tend to see patients reporting just overall sort of improvement in their health-related quality of life after getting care that they need and getting access to services that they need through our programs.
Thank you so much. Fatawu?
Also, I wanted to add about the improvement of health when community health workers are sustained or maintained. We have seen a whole lot of research information out really attesting to the improvement of health, savings in cost of healthcare, and also satisfaction of patients when community health workers are introduced or are included in health systems. Thank you.
Thank you. And Carl?
Yeah, real quickly, I think we've heard a lot about the proven effectiveness of community health workers. Perinatal community health workers can also complement the work of doulas. And I think it's clear that birth outcomes are a huge concern in just about every state, not only in terms of the impact on lives, but also the cost of prematurity and low birth weight. But we have plenty of data on things like impact on clinical outcomes in chronic disease. But there's a lot, as we talk in most states, about reforming primary care. There's a lot of interest on the part of state Medicaid offices, folks involved in the primary care system, of course, where we have managed care. In other states that have managed care, they are also interested in the question of patient engagement. There's a huge percentage of Medicaid recipients who never go to primary care, and then they may end up in the emergency room. And so there are huge benefits to the system and to the community by people accepting primary care. And also clearly a lot of interest in behavioral health and the ability of CHWs to engage people in behavioral health. And I apologize to the interpreters. I started speeding up there. So the behavioral health is a big area of interest right now. We know that CHWs can do a lot in terms of helping to overcome stigma and improve people's receptiveness to entering treatment.
Thank you so much. There is another question, one that states, will obtaining certification increase CHW pay rate?
I'll go first. So with that, I think we've had a lot of questions about this in the past, about some people really looking to take the certification or looking to be certified to get a higher rate. So with that, I would say that it hasn't been something that is promoted that much, but certification leading to high pay. But definitely certification is an added benefit for community health workers when you are looking for work, because there are some employers who are looking for certified community health workers. So that means that they need people with structured training. So you have gone through a structured training, and then or maybe you have gone through some kind of evaluation to attest your knowledge of being a community health worker, which is the experience path of being a certified community health worker before you are certified. So with that, I think it won't really increase your pay, but it will be an added benefit to you when you are looking for work.
Thank you so much. We have about 4 more minutes, so I wanted to get one last question in. Carl, I see your hand up.
Yeah, quickly, I think Fatawu said most of what needed to be said there, but I do think that the prevailing wage rates for CHWs are an issue that has to be addressed separately. And I know that Denise and everyone else at NACHWA will agree with me that especially if we expect people in coming from low income communities to continue to serve, they need a living wage. And further, employers are coming to recognize if they don't pay people a decent salary, they're going to have a turnover problem. And so it's in their interest to pay a living wage and benefits to allow people to remain in this field.
Thank you so much, Carl. One last question, and I know that we can carry on and have so many questions come, but this last question, and I want to apologize ahead if I mispronounce the name, but I am Ifeoma Nakwanko from the Department of Social Services, Division of Health Services. I would like to use this opportunity to appreciate the work of community health workers, especially with regards to health services to Connecticut communities. Could you please speak a little on the work that CHWs have been doing in relation to the issues of families who dropped out of the health insurance coverage due to the impact of COVID-19 public health emergency? And the caveat to that is many such families are not aware of the options and or resources available to them for securing coverage. What is the experience of CHWs in assisting with identification and outreach to such families? In this question, I would say let's direct it to our community health workers. So Bianca and Fatuma.
We are in constant communication with community members. A lot of people don't receive communication or they are not aware of what's happening in the outside world. And we are in constant communication with them. And for example, there's a lot of families with kids that doesn't born in the United States and they don't know yet that they now can apply for Husky for immigrant kids. So because we have more constant communication with them, they trust that yes, you can apply and there's not going to be any problem in the future if you apply for this Husky. They start to know more about the research in the community because we are in constant communication. We speak with them in a more not informal but in a familiar way, and they trust more in us. So they are working a lot. They are not they are very focused trying to provide the food for their families. So they don't have time to see the news or something like that. So because we have that connection and they can know more about the research, different research in the community.
Very quickly, also just wanted to add, what we do also is being able to attend outreach events, and we take it upon ourselves to make sure that we understand all of these resources within our communities. We print flyers, we print brochures, we take those with us, and we talk to families. And when we identify this, we are able to support them in that direction. And we also take referrals, like community health workers everywhere. When you tell them this family need this, they take it upon themselves. And that is part of what Millie said in the beginning. We don't discriminate. We serve everyone, and we take it upon ourselves to support whoever we meet in the community. Thank you.
Thank you so much. Tiffany, I see your hand up.
Just briefly, one of the things that I love that was a focus and talked about is how community health workers are trusted and have the cultural humility to really connect with community. So they are critically important at times like this, when many of our Connecticut families, over 400,000 individuals, are going to lose healthcare coverage or need to redetermine, not necessarily lose, need to redetermine because of the end of the public health emergency. And we know community health workers are critically important. In the chat, one of my colleagues put in a grant opportunity that we have. And so we are hoping that we get organizations that do have community health workers to apply, because we do have a trusted messengers grant that we have as an organization to do just that, to really communicate around the changes in healthcare insurance. And so we're hoping that we get community health workers as part of that. So I want to also mention that there may be a grant opportunity to support community health workers.
Thank you so much, Tiffany. And as it's now, we are at time, I really want to take some time to say a special thank you to all of the commissioners that have joined us. Tiffany, for the work that you have done today and the continual work that you do. Our panelists, our moderator, the Office of Health Strategy, the Community Health Workers Association, Connecticut Public Health Association, the Connecticut Foundation, and our team over here at Health Equity Solutions. I just want to thank you. And then in more, I want to thank community health workers, all of you who have joined, allies who have joined. This is a very important discussion, and we need to continue to have more of these discussions. And we appreciate all of the hard work that you all are doing. Please feel free to reach out if you have any questions. In the chat, there is information on how you can send over questions to us if you have any, and we'll make sure that we'll get back to you with the answers. We hope that you have a wonderful rest of your day and continue to look out for community health workers. Thank you all and have an amazing day.